How important is the supportive care in oncology? Some people underestimate it clearly, and some others say it's almost as important as the main treatment. What is your opinion?
Well, of course, I'm the second opinion. I think that supportive care makes excellent cancer care possible. This is the motto of MASCC, Multinational Association of Supportive Care in Cancer. There is now growing evidence that patients that are related to supportive care groups have a better outcome than those patients that are related later to supportive care groups. So I think that it's now beyond discussion. Supportive care, which means in supporting the treatment and after the treatment all our patients, is extremely important.
There are at least a few sets of guidance for supportive care. How well are they followed by doctors, and what are the reasons for they not being followed in some cases?
Guidelines in medical field is available for treatment and for support, but doctors don't follow guidelines. Doctors always believe they know better. However, we have evidence that following guidelines, the outcome of the patients is improved. Following supportive care guidelines, for example, against nausea and vomiting, improves by at least 10%, an absolute improvement in control of nausea and vomiting. Any doctor who hears that should be jumping up and saying, this is fantastic, I have to follow the guideline, because this is a great improvement. The reasons why doctors don't jump up and follow guidelines are many, some related to availability of the drugs, but a lot about the fact that patients do not report back to the doctors that they have nausea, that they have vomiting, because patients believe it's normal to have nausea and vomiting, so doctors underestimate the problem.
Are there other benefits of following guidelines other from medical?
When you apply a guideline that is evidence-based, you're applying the best possible treatment for the particular situation. That will improve outcome. Improving outcome means, let's take the example again of nausea and vomiting, that patients will not go to emergency care because of nausea and vomiting. Patients will need less consultations with the doctors because of nausea and vomiting. So that is all benefits in terms of the society. And in other words, it's a benefit in terms of the money spent in preventing the problem.
What would you advise a doctor or a decision-making person who is skeptical about supportive care?
Well, skepticism about supportive care can be viewed in many ways. If you look at control of fever, and febrile neutropenia, which is related to possible patient deaths. It's difficult to discuss with doctors, but when you're talking about nausea and vomiting, it's very simple. I just tell them, take a glass of Ipecac, which means 100% risk of nausea and vomiting, and after that start talking to me. I don't want anyone to have nausea and vomiting.